Welcome to this clinical condition. We are back with Shawn Eno of Xtreme Footwerks. In this one, we are talking about orthotic trimming and just really what you should be looking to do depending on what you need. This one specifically with a custom fit orthotic, but some of the general principles can be applied to just inserting an over-the-counter one, which Shawn may or may not recommend, depending on the specific case, but lots of good things to take away here. As always, if you're just listening to this, we highly recommend you check out the video. Enjoy.
All right, we're here with Dr. Bolin today to discuss trimming your custom foot orthotics. They are often, and in most cases, mailed without knowing exactly what brand of shoe, style of shoe that they're going to go into in terms of the forefoot configuration. So when we look at a typical shoe, this is what we call a forefoot configuration. It's the pattern that the last was shaped, the shape of the last that the shoe was created from. The last is a nylon or wooden model of the foot that the shoe is constructed around. Last pattern is very relative to how the nose of the orthotic fits into the nose of the shoe. So here's just an example of where this is pretty close, really, to the outside. If we look at the inside of it, of course, everything's a left when I need a right. When we look at the inside of it, essentially, we want an orthotic to sit flush inside the shoe, not too small so that it slides around inside the shoe, not too big so that it doesn't fit inside the shoe. This particular shoe also presents a forward-leaning heel counter here, which many shoes do. So it might seem like it doesn't fit, but it has to plop down in there and then recess back in that area as well. So the point of that is that these orthotics often show up with a larger forefoot paddle so that we can trim them to fit to any number of forefoot configurations. So when those are received by the practitioner, or if you as the patient are doing this as well, you're going to want to take your factory out of your shoe and plate it. We use the term plate like stacking plates so that it sits on the edge of the counter flush here. Those are the edges of the heels. And then we look and we get the pattern. We take the factory and run our fingers up the side and make sure that the factory is centered up near the edge of the shell. The edge of the shell of the orthotic is where the top cover leaves the plastic. That is the shell edge. And so once you've placed the factory onto the bottom of the orthotic, and we can also test where we're at, place on the top. But we recommend you do it on the bottom. Place it on the bottom, draw your patient's factory insert onto the custom provided by the lab, and then you've got your demarcation here, and then you take a set of scissors and follow and trim around that line. We won't trim this today, but you understand. Bear in mind, you can always take more away. Can't put it back. You cut it too small, it becomes a problem for the lab to fix, most likely. And sometimes you'll need to trim a little width off here. The lab does get the width usually pretty close because of the pedograph provided in most cases, or we also can learn from the cast itself how wide the foot is. And the width of the shell portion of the orthotic is predetermined to the pedograph or cast, and then the design, but the shell is often, or the top cover is often left a little wider than the shell, and a little bit of trimming can also assist with making sure that it then plops down and fits into the shoe well. Can you think of any questions or anything we've missed today, Dr. Bolin?
No, I think it's pretty self-explanatory. I think you covered it pretty well.
Now we'll just go one step further. I was answering my own question too. We can also trim orthotics. Sometimes we'll provide them to the lab in what's called a sulcus length. so that it fits underneath the ball of the foot, but not underneath the toes. If the cover is thinner than a 5, like a 3 mil cover, see the thinness there, then you can often trim a cover back to either that sulcus length value, which here's the metatarsal line of the orthotic. If you were going to cut it met length, you'd cut it here. If you were going to cut it sulcus length, you cut it up there. The met length orthotic is typically more universally applied to dress shoes and shoes that didn't provide the patient with enough room to have anything in the front. So if there's no factory removable insert from a shoe, then in many cases, most cases, a full length orthotic isn't going to sit in the shoe unless the shoe is voluminous to begin with. And so we can cut down a full length orthotic to a met length orthotic just by trimming the cover in advance of that line there. And then sulcus is just up in this area. And we can draw dots in front of each met head and cut to sulcus. And those are some advanced trimming techniques we don't expect anyone to do. You can order those lengths from the cover yourself. But when it comes to the issue of mailing things back and forth, there is the possibility for you to make some minute changes on your end or on the patient's end before sending it back to the lab. And with the caveat that anytime we mess something up with the covers, we can always resurface it and fix it at the lab to make it right.
Sure. So when a full length ordered, would you recommend taking that factory insert out then and using the full length lift in place of? So they're not putting them both in, just to clarify.
Right. Yep.
Cool.
And we'll do a small segment on orthotic break-in at some point. We could talk about how the factory insert retains a role until you're fully familiar with the use of the orthotic, and or can be applied underneath the orthotic to take up volume, which can be an issue for like low volume slender feet. And also for some shoes that just got constructed with a bunch of up-down Z-axis volume. And so some patients just end up leaving them in there, but in most cases they come out.
Okay. Maybe this is a topic for a question for a different topic, but how often do you recommend individuals replace their orthotic and or get them refurbished?
So we all know how much a shoe lasts, right? So imagine you wear the same pair of shoes almost every day. Then that shoe's going to last you how long? So we can all kind of think back, oh, I had that one pair of shoes for X. It really comes down to about a year. Some shoes, if you're a runner, for instance, you're going to have that shoe wear out a lot faster. So it's a step contingent reality. It also depends on who the patient is, how much they weigh, how much pounds per square inch they're exerting through their foot. Little old lady shows up, I can chide her gently and ask her if she's even worn them at all. Then we can have somebody who's like 240 and 6 foot come in and has them 3 months, and I'm looking at the top cover going, well, whoa, what'd you do to it?
Sure.
And, you know, they probably have the same thing going on with their shoes. So we try to look at the design features for a patient, build them a little burlier for those people that are harder on them. But the hard and fast rule is that when your shoes wear out, you ought to have a look at your orthotics too. And if they get paper thin in certain places up here, especially past this shell, which has a more rigid and dense construction, therefore lasts longer. A general rule of orthotics is that the more accommodative and cush they are, the less they last, so that durability and cush are inversely proportionate. For example, we can build you a steel or a wooden orthotic that would last a very long time, but you wouldn't want to wear it.
Sure.
We can build you an orthotic that you would love day one that would be toast by day 10.
Mm-hmm.
So we try to fit in between. And so you look for complete compression of the cover underneath the med heads or the distal toes as an indication it's time to have them resurfaced. And then you look for, you kind of like try to say to yourself, when I first got this thing, it had this arch profile. And just generally speaking, after several years, you're not going to have this arch profile anymore. And you're also going to see some real wear around the heel cup, particularly in the EVA shell device. Hard plastic, it's basically we're at the point where this cover is completely degraded and you start seeing the plastic show through the cover, then you've gone well past the point in time to have it resurfaced. We don't put a lot of people on plastic orthotics because most people can't tolerate a hard object against their foot. So it's really only for serious athletes and healthier feet on the active end of the scale.
Sure.
Maybe 1 or 2 out of 10 pairs.
And I know you do refurbish, so do you recommend they just send them in and you can be the determinant if it can be refurbished or if they should just start over with a new one?
Yes, or if the practitioner has any questions, they can send photos so we can determine how toasted they are.
Cool.
The general rule on orthotic replacement is every 4 years roughly for the actual orthotic. The lab is typically only keeping casts 1 to 2 years, but as we shift into digital, we'll have those casts longer. We recommend everybody consider a recast every 5 years due to changes in the feet. But with the pedograph, we can take pedographs and use a light box, like looking at x-rays old school style, and compare the pedographs. And if they don't look size-wise that much different from each other, then the existing cast is probably good to use even after 4 or 5 years. So that's how to determine that.
Cool. Sweet.
The orthotics can be resurfaced 2 or 3 times if done in a timely manner. And the other thing it brings into question is some people don't like to part with their orthotics even when they're worn because they benefit from them so greatly that they should consider a second pair. And 2 things that occur when ordering the second pair is that they can really compare the worn pair to the new pair to determine how hard they individually were on their orthotics and determine what that expected lifespan can be for the second pair, giving them a better idea of when to replace for that, third pair down the road, and also then gives them something to have in their shoes when they send the first pair in for a refurbishment. So the second pair kind of gives them the chance to mail in a pair to see if it's even worthwhile, then to mail them in and get them resurfaced, and then they can get those 2 pairs in kind of a shuffle for a little while longer, and they'll know when they need to order and fully replace the first pair with another pair. I recommend that for people who directly benefit and know they can't live without them kind of thing, live in another market, their lab's in another town, 2 pairs are just going to last longer. It's kind of like if you used, a pillow for odd nights on the calendar and another pillow for even nights, and those pillows got to air out and fluff up every night. Same thing goes with orthotics and shoes. If you give them a break and you're not beating them up every day, they tend to last longer than they would if you wear them every day.
Cool.
All right.
Great. Yeah, awesome. Thanks, Shawn.
Thanks a lot, Kyle.